Okay, so today we're going to be doing some active range of motion, some passive range of motion, and some resisted range of motion of the hip. To begin, I'm going to be doing some active range of motion, and that'll usually tell if there's any deficits in planes of movement. Resisted is usually to differentiate between musculature, and passive will let me know if it's any ligamentous. So I'm just going to have Paul get on the table, and I'm going to be starting. So to begin, we're going to be doing some active range of motion testing of the hip. So what you're going to have you do is have your patient flex their leg, especially at their knee, and try and bring it as close to their chest as they can. And bring it back down. And a normal range is about 120 degrees. Next, I'm going to have the patient do abduction. So what you're going to have to do is pull your leg as far off the table as you can. Okay. And for adduction, there's two ways you can either do adduction. You can either have the patient bring their leg off the table and drive their other leg towards it, or you can position their leg and then bring it across. Next, there's internal and external rotation. So I'm going to begin with internal rotation. So you want to, and I want you to drive your leg inward in this direction. Okay, and I want you to bring your leg out this way, as far as you can.
I have to.
So usually external rotation will have a lot less movement than internal rotation, so that's kind of common. And then for extension, you're just going to have your patient turn over. And they're going to lift their leg as far off the table as they can.